We fear that we have had front row seats to a medical scandal.
Of course, this woman did not come on camera out of her fear of being heard.
Just realising how traumatic the experience was.
Young people who've perhaps thought they'd like to review their decision, again, one or two.
When you're transgender, it's excruciating.
I think this is absolutely insane.
Let's go. So children as young as 7 years old are to receive transgender treatment on the NHS. Is this a step in the right direction or just one more towards a potentially unfolding scandal? Keep watching to get my thoughts. Hello everyone, my name is Jack. Welcome back to this channel. If you like my content, please take a second to subscribe and like this video. I would really appreciate it so you don't miss any future content. With the culture wars more prevalent than ever, I've had my eyes on the transgender agenda and the discourse between the left-wing activist community and those more center or right-leaning on the topic. And I firmly believe in the right to free speech, in particular social justice issues, without facing backlash, aggression, censorship, or cancelling. I've noticed more and more that as a member of the LGBT community, if I or someone else does not subscribe to a certain set list of opinions and ideas, people can get completely excommunicated, lose their friends, or in worst case scenarios, their jobs. This is a huge problem in the field of academia, where student protests have literally driven professors off campus simply because they had their own opinions. I'm not even talking about ideas that are laced in genuine aggression, hatred, the term that the activist community like to use a lot, fascists. I believe that every political issue, including social justice issues, have nuance, and that's why I would like to join this conversation, as I believe there are certain causes that require more voices behind them, particularly from the LGBT community. I think there are lots of people who feel certain ways and don't feel safe to come out with how they feel. The more and more we can discuss and debate these topics sensibly and respectfully, I think the further towards legitimate progress there is to be made. So on that, let's discuss the issue. So on Friday, it was announced that children as young as 7 will get transgender treatment on the NHS, according to plans seen by the Telegraph. So at first, this doesn't look great. I wasn't aware that children younger than 7 were actually being given transgender treatment, as previously there was no minimum age for referral, and children as young as 3 years old were being treated by Tavistock. My initial thoughts were even 7 seems very, very young to be able to fully grasp concepts of gender identity. However, I think a positive step in this story is that these children will be offered psychological support and therapy that will focus on issues that may have led to their feelings about their gender. So the plan also states that children under 7 years of age may not be expected to have sufficiently developed their intellectual understanding of and comprehension of sex and gender to be able to understand the reasons for and potential consequences of a referral to the specialist gender incongruence service. All right, so let's pause there. I definitely think this is progress. Personally, I do not believe that children under the age of 18 should be allowed to medically transition. I do not believe that children have the capacity to give consent to make life-altering permanent decisions. At a young age, we do not understand the concept of permanence. Children want things and they want them now. There have been many children who've been put on puberty blockers, who have now been permanently sterilized and infertile for life, and also received irreversible surgeries. When I think of this, I was trying to imagine myself in this kind of scenario. And one of the issues I think is that some of the adults involved in this process seem to have forgotten what it is like to be a child. When I was a child, I had lots of different ideas about what I wanted to be and who I was, and these would be changing every few minutes. I guess the closest experience I had that I can liken to this is when I was 14 years old. I was struggling a lot with my mental health due to having acne. My acne wasn't even that bad. I was just very, very self-conscious about it. So I was hugely persistent to my mother that I wanted to go on this medication called Roaccutane. I discovered this medication online. I'd watched many YouTube videos of people who had undergone this treatment, and then that was it. My mind was made up. I wanted that medication and I wanted it now. When I was a kid, I was very opinionated and very strong-willed, so my parents would often end up conceding at times. It's difficult for parents to make decisions for their kids, especially when their kids won't take no for an answer. When we did go and see a dermatologist and he informed me of the potential side effects, my reaction was just like, yeah. Get me on the medication, I want it now. My mother was skeptical. She was fearful in particular of the fact that one of the listed side effects was potential thoughts around. Doctor did reassure her of that. I think in that capacity, I did not have consent to personally start myself on that medication. I was 14 years old. I could not grasp the concept of even the short-term side effects and how that would affect me mentally. I had an opinion that, oh, well, that's not going to be me. I'm going to get through it fine. Don't worry. My mother in this situation did have a difficult decision to make. It was up to her to provide consent on my behalf. And she weighed up the pros and cons and obviously decided that the impacts my acne was having on my health outweighed the very minute risks that some of these rare side effects had on the label. On reflection, I believe that she made the right decision. The medication worked for me. I was so much happier. However, I just want to reiterate the fact that this does not mean I believe that this will be the case for all transgender children. What I'm trying to put across is that children do not have the ability to provide consent for these sort of decisions. So I'm just editing this video, and I think after watching that clip, someone could misconstrue the fact that I sound hypocritical, as my mother did go ahead with that treatment. But the difference here I can see is that when I had acne, this was a very visible problem, physical problem that was easy to diagnose by the doctor. And when we talk about gender identity and being transgender, this is a highly subjective experience, and you'll see more later on about how sometimes it may not always be the right course of action. We do not allow children to drink alcohol, buy cigarettes, buy lottery tickets, get breast augmentation, but obviously the UK has backpedaled on this. In the US, they're still going full steam ahead in several states, allowing children to permanently alter their bodies, make decisions that they will never be able to have children, remove their breasts. I think it's absolutely insane. Even as young adults, I think the concept of making decisions that are potentially life-changing and permanent is extremely difficult to grasp. Another personal anecdote I have here is that when I was in my late teens and early 20s, I was attending drama school and was on a path to be pursuing musical theatre professionally. I graduated and this was the path I chose. There were lots of professionals who had worked in the industry that were providing our training. They would regularly offer advice saying it's an extremely hard industry to work in. It's a real grind. You have to love it through and through. Never going to really have that much money in theatre. It's hard to have stability. It's hard to plan and have holidays. But of course, I heard that and I was just like, yeah. I have a thick skin and money's not that important to me. When I gained my independence and I saw that some of my peers were able to save for a house, plan to go on holiday. These were all things I realized that actually were very important to me in the grand scheme of life. Because of some of those realizations, it led to my eventual moving on from that industry. With that decision, it was fine. I could just change the path of life I had chosen, and I had many valuable lessons I learned from that industry. In a way, that was like no harm done and let's do something else. If I had permanently altered my body by use of medications, then it doesn't matter what decision I make, there's a certain element of that I'm not going to be able to come back from. I really can't fathom how any medical professional was advising parents to put their children on puberty blockers, of which there have been zero long-term studies on how these will affect children's health. It's like bringing your child to the GP because you think they have depression and your doctor saying, oh yeah, well, there is this antidepressant that I can put your kid on and it's not been tested on people. It's not been tested on kids ever, but I'm happy to put them on it. And then the parent going,
yes, that sounds like a great idea.
The concept of that is insane to me, but then for some reason for this, there is this blind affirmative approach of putting kids on these harsh medications. And if you don't believe me, this was a practice that was occurring at the Tavistock Gender Identity Clinic until last year it announced its closure after a review that it was deemed not safe. Let's see a short clip from Sky News from a few years ago on one of the professionals who worked at the Tavistock Centre explaining the rigour behind the process.
Hello.
Hello, Debra.
We came to speak to senior clinician Bernadette Wren, who told us they fully inform children about the consequences of medical intervention in their teenage years.
The work that we do to really inform these young people as fully as we can what this means to start taking, say, testosterone in the example, what that means for them physically, what are the irreversible impacts of that, what are the impacts on fertility, what are the possible, to consider the possible impacts on their sexuality, relationships in the future. Of the young people who've perhaps come to us and thought they'd like to review their decision, they, again, one or two, they have always said that they felt we have done everything that we could to make clear to them the gravity, really, of the choice that they're making.
Okay, I mean, my favorite part is where she says, one or two that came to us. I don't disagree with anything this lady is saying. However, I think the point she's missing is that it's fine if you inform these children of, oh, these are all the things that could happen to you, and like you may not be able to have children, there may be these potential side effects. And it's fine if they also say to you, oh, but you did everything you could. Because the bottom line is that children cannot consent to this process to begin with. So it doesn't matter if you're telling them about all of these potential permanent complications. Take, for example, alcohol. Children cannot consent to drinking alcohol. A 12-year-old is like, no, I'd like to drink alcohol. And then the process we follow is the adult informing them, well, you know, you can, however, this is how it'll affect you. It may have these side effects to your liver, you may pass out, you may not remember things. Then, of course, the child might say, oh yeah, but like,
that's not going to happen to me.
No, I think it's comparable. No? And then when it comes to making choices on long-term decisions, let's hear from a transgender patient who did not regret going through the medical transition as a minor.
I'd have to talk in depth about my dysphoria. I was asked questions about my future and if I wanted to freeze my eggs, stuff like that, which as a 14-year-old, 15-year-old is quite difficult to think about.
And how did you answer that question?
Personally, my view of it is that I didn't want to because the process I thought would have been quite difficult. I would have struggled because I would have had to go on estrogen, which is obviously not something I wanted for a month, and then there's a process of extracting the eggs and everything. And if I wanted kids in the future, which obviously I'm not certain about, but I could always adopt.
Okay. I mean, I have compassion for this individual and I'm so glad that he is happy with his transition. However, I think this is a clear indication that as a child, you cannot comprehend the idea of making yourself permanently infertile. When asked, how did you make that decision? He said, well, it's very hard to think about when you're that young. If he wants kids, although he's really not sure if he does, well, of course not, because he's a teenager. When I was a teenager, if you had asked me, I would have probably said, hell no. I mean, I'm 29 now and I'm still not too sure, so there you go. But if this individual gets to, 21, 22, etc., and then realizes I actually really want a biological child, that option is gone. Let's take a look at some of the negative outcomes of the use of puberty blockers and the medical transition on minors. One of the cases that made headlines in the UK was that of Keira Bell, who actually sued the NHS because of the use of puberty blockers and cross-sex hormones.
Children like Keira Bell, who never imagined her story would lead her here.
I'm delighted at the judgment of the court today. It was a judgment that will protect vulnerable people. I wish it had been made for me before I embarked on the devastating experiment of puberty blockers. My life would be very different today.
Keira was 16 when she went to the Tavistock Centre. She started receiving hormone blockers and later surgery to become Quincy. She regretted the decision, and today, in a landmark ruling, a judge said her case had shown it's doubtful 14 and 15-year-olds could understand long-term risks of treatment, and highly unlikely children under 13 can give competent consent.
I was extremely upset and, how traumatic the experience was and how deceitful I feel that the clinicians were during my care. It was heartbreaking.
Okay, it's devastating to watch, and I'm really glad that she's got some level of justice through suing the NHS. However, you can see that her voice is permanently deepened. That's not going to change. Girls have further complications such as, facial hair, bone structure permanently enlarged and altered. Testosterone in particular is an extremely powerful drug. So there's lots of changes that, there's no coming back from this. And the fact that professionals have debated that children under the age of 13 may not be able to provide consent. 13 is ridiculous. We're talking 18 years old, an adult making a decision that will permanently affect their body. My heart really goes out to her. I feel really, really sorry for her in that process. If I was in a different generation, being a gay man, having atypical gender expression and behavior as a kid, could I have been led down a potential path? I'm not sure. This did incite a ban for puberty blockers, and it will impact children up to the age of 17, which I think is a very good decision. In July 22, there were in fact 378 children or young people being treated with puberty blockers, which I think is absolutely insane. And when you look at the side effects or potential long-term side effects of puberty blockers, of which we're not sure at the moment, as there have been no long-term studies, we have weight gain, headaches, mood changes, hot flashes. And then in terms of the long-lasting implications, it may affect growth spurts, bone growth, bone density, and of course, fertility. I've read other articles and heard from other professionals that it may cause brain swelling. So the good news is that the NHS are at least acknowledging the fact that the current children that have gone through the puberty blocker process are essentially guinea pigs. They concluded that there is not enough evidence to support the safety or clinical effectiveness of puberty suppressing hormones to make the treatment routinely available at this time. Only children who have experienced early onset gender dysphoria starting at a young age will be eligible for trials. So for that, we're talking about clinical trials. Now we're looking at this being confined to more of a research setting, which should have been the case to begin with. Again, this has never been done before. I hope that this is only in some of the most extreme cases of which psychological support is not providing any method of relief or getting that child to a place of acceptance that they have to wait until they're 18. And we also hear from Stephanie Davies RA, apologies if I'm pronouncing that incorrectly, founder of the Transgender Trend. So she says, I have still got questions about children being enrolled in an experiment on puberty blockers where the benefits have not proven and the long-term risks are huge. It's also crazy to imagine being a parent that has to make the decision of whether your child would be part of a research experiment such as this, and I can imagine that'll be an extremely difficult decision to make. But before any of this unfolded, it was common knowledge in the medical field that gender dysphoria, which is the manifestation of feeling like you are in the wrong gender, that your gender identity does not match your biological sex, actually desists in 60 to 90% of cases when a child is allowed to go through their natal puberty. So children presenting with gender dysphoria, the large majority of them will desist in these feelings. And then for the percentage that remain, that 0 to 40% of people, obviously transitioning as an adult then becomes the next course of action. However, should certain children be allowed to do this in certain cases? Let's have a look at the other side of the argument.
This is Leo. He's 16 years old and was born female. He now identifies as male.
In my school, I'm pretty sure I'm the only trans person.
Leo first came out as transgender at 11 years old. He began medical treatment 2 years ago, taking drugs to pause his female puberty. Recently, he began testosterone treatment, which does things like lower his voice and promotes hair growth.
When I started my periods, that was something that really was an indicator for my parents that things weren't going to change, it wasn't a phase, because that worsened, puberty worsened my mental health, worsened my gender dysphoria. When you're transgender, it's just different. It's excruciating.
Once again, I'm happy that he's happy with his transition. And of course, I acknowledge that there will be children, even if it's a large percentage, that may benefit from that process as a minor. And that's without these potential long-term physical and mental health side effects. What about the percentage of people who grow up and do not feel this way? I don't believe that we can sacrifice one group of minors for the sake of another. What's even more astounding to me is how therapy and psychological investigations were not part of the process for assessing the correct course of action for these minors. This actually led to many psychologists at the centre resigning, since had whistleblowers from the centre. Let's check out what one of these psychologists had to say.
Was the only clinician prepared to be interviewed. They asked us to change their voice.
I was once working with an executive that felt the gender dysphoria a young person was presenting with was really strong, really intense. So she decided to put the young person forward for the hormone blocking treatment after 2 appointments. Looking back, it was a young person with a history of trauma and direct trauma in terms of abuse. And also there were other things happening to them, and this was not really explored by the clinician.
These views were echoed by others who had worked at the clinic. Therapy is not an option in this service, one psychologist told us. We fear that we have had front row seats to a medical scandal, said another.
So I just want to make it clear that I do believe that gender dysphoria is a legitimate mental disorder. I think there is a medical and a scientific basis for it. And I also acknowledge that many adults may fully benefit from the process of medically transitioning to integrate themselves socially in society as the opposite sex. Full support of consenting adults being a part of this process. I'm full support of the transsexual community in this way, provided that they are given thorough medical care and advice and assessments from doctors and the people prescribing these treatments. So the question here is, will the new protocol of the NHS in providing therapy for children from the age of 7 experiencing gender dysphoria be an improvement to the process? The fact that children presenting with these ideas are referred on this path to begin with, this could subsequently still rush certain minors down a medical pathway that eventually leads to physical medical transition at 17 or 18, some of which may actually have benefited from a different path. So we hear from Dr. David Bell, a consultant psychiatrist and former governor at the Tavistock before he became a whistleblower, said, "For me, there is a structural problem which needs particular caution. Referring a child to a gender service, even if they are seen in the context of a multidisciplinary team, in that the mere fact of referral is consequential. My view is certainly for younger ages, children should be managed within the context of the ordinary child and adolescent mental health services. Of course, I believe that children with gender dysphoria should be given the correct psychological treatment. However, if you immediately put them down a path of saying you are presenting with these feelings that you require the psychological care for gender dysphoria, it may fail to pick up on other underlying causes for that mental distress. And due to the blind affirmative approach we've thus far had, this has led to clinicians failing to notice the comorbidities involved in some of the patients. And I don't understand how, as a society, we have become so simple to not acknowledge that this area of medicine is clearly nuanced. There will be people with legitimate gender dysphoria, and there will of course be others who believe they have gender dysphoria, but of which there are other underlying factors at play. And the fact that questioning minors when they have these ideas is considered to be transphobic, I don't even know how to comprehend that. Have you ever gone to the doctor thinking you have something and then realizing, actually, false alarm, it's fine? It's like me going to my doctor with heart palpitations and chest pain and saying, I'm pretty sure there's something wrong with my heart. You need to do something about it. Instead of the doctor assessing me and making a diagnosis of anxiety and panic disorder with panic attacks, the doctor just says, oh, well, okay, well, you seem to have it figured out, so I'm just going to give you a referral to a cardiologist and you will have some heart surgery.
Sounds great.
So to illustrate this further, I want to talk about a book called The End of Gender, written by Dr. Debra Soh, who is an ex-sex researcher and now turned journalist. And in this book, she discusses many pertinent topics when it comes to gender. There is a chapter all on children transitioning and the controversy surrounding that. She does not believe that children should be allowed to medically transition. One of the clear reasons and markers for this is that numbers of minors presenting to clinics having gender dysphoria. Between several years ago, the percentage of males to females has completely inverted. So now you have a very large portion of young girls presenting with gender dysphoria. There have been legitimate documented cases of females with undiagnosed autism that have been led down this path incorrectly. Females have also historically been more vulnerable to social contagions. I'm thinking of situations such as self-harm and eating disorders. Of course, this also affects young boys and men. However, it affects young women of a more proportional degree. So if a young female starts to become uncomfortable with her body as she goes through puberty, develops breasts, gets her period, I've heard from other women that most females feel uncomfortable during this process, as well as taking into account that some children have experienced trauma, PTSD, the list goes on. This can lead to minors self-diagnosing themselves as transgender as they are sucked into these communities online and fed a magic solution to how they're feeling. Even more, we see a problem developing with minors transitioning in parents and children wanting to escape the reality of being homosexual. When they would have been a cisgender homosexual, after transitioning, they are now seen in society as a heterosexual, essentially. I've seen interviews of detransitioners and stories in which this has happened, where someone is actually a lesbian, but has incorrectly identified this as being in the wrong sex. I feel the community is so polarized on the topic of transphobia that we've actually left homophobia and misogyny at the waistline. Being a female can be more difficult than being male in this world, I acknowledge that. And there are young girls who want to escape the reality of what it means to be female and a woman, especially those who've been physically abused and don't want to be vulnerable in these situations anymore. And there is the reality of others wanting to escape this because they are actually gay. What's more disgusting to me, which Debra Soh also talks about in the book, is the fear-mongering tactics that doctors have used in the past and potentially are still going to use in order to get parents to make the decision to allow their child to transition. You hear this phrase of doctors saying, well, would you like to have a happy daughter or a dead son? I think this is so unprofessional and absolutely disgusting for doctors to say to parents, to put this burden onto them and this blind assumption of which they have no proof will occur. If you're the parent, what else are you going to do? Of course, you're going to go ahead. And this comes back to the social contagion element. If kids are online and being fed by a community, well, if you don't transition, you will likely want to kill yourself. I'm not saying that there are not kids who are, but that's of course not what I'm saying. However, has this been blown out of proportion? Where is the medical basis for this? I think that's all I have to say on this topic for now. I'm glad that we're making steps in the right direction. We will have to see what these therapy services entail and whether they are rigorous enough to segregate the children with legitimate gender dysphoria and those who have other issues that require other forms of treatment. Please let me know your thoughts in the comments below. Is this a step in the right direction? Should children be allowed to medically transition? I welcome open debate and criticisms towards my comments, but let's just be respectful of one another's views. And anyway, that's all from me today. I hope you enjoyed this video and learned something new, but otherwise I will see you soon. Bye.